Hello everyone. Today we will discuss about renal function test. Kidneys play a vital role in the excretion of waste products. Waste products and toxins such as urea, creatinine and uric acid. Then regulation of extracellular fluid volume and electrolyte concentrations. Regulation of extracellular fluid volume and electrolyte concentrations, and the production of hormones like erythropoietin and 125 dihydroxy vitamin D and renal. These are the main functions of kidneys. The functional unit of the kidney is a nephron. This is the functional unit of kidneys. This nephron consists of glomerulus, proximal tubules, distal tubules and collecting ducts. So based on the functions, the renal function test can be classified as test based on glomerular function, glomerular filtration, test based on glomerular filtration. This include urea clearance test, endogenous creatinine clearance test, then inulin clearance test, then Chromium-51 EDTA clearance test. Then second type is test to assess kidney diseases. To assess kidney diseases. This include serum parameters. Serum parameters means serum urea, creatinine, electrolytes. Electrolytes are sodium, potassium. That is serum parameters. Then urine analysis for abnormal constituents of urine. Then third classification is test to measure renal plasma flow. To measure renal plasma flow. This include para-aminohipurate test, then filtration fraction. Fourth one is test based on tubular function. Based on tubular function, this include concentration and dilution test, 15-minute PSP excretion test, measurement of tubular secretory mass. Then next one is certain miscellaneous tests. Miscellaneous test. This miscellaneous test can determine size, shape, asymmetry, obstruction, tumor, infarct, etc. So today we will discuss about the test based on glomerular filtration. Test based on glomerular filtration. This include urea clearance test, then endogenous creatinine clearance test, creatinine clearance test, then inulin clearance test, and chromium EDTA clearance test. Chromium EDTA clearance test. So first we will see urea clearance test. First one is urea clearance test. So what is meant by this clearance test? Clearance is defined as a volume of blood or plasma which contains the amount of the substance which is excreted in the urine in 1 minute. Clearance is defined as the volume of blood or plasma, which contains the amount of the substance. The amount of plasma or blood which contains the amount of substance which is excreted in urine in 1 minute. That is called clearance. In other words, clearance of a substance is defined as the volume of blood or plasma cleared of the amount of the substance found in 1 minute excretion of the urine. So coming to the urea clearance test, this blood urea clearance is an expression of number of ml of blood or plasma which are completely cleared of urea by the kidney per minute. It is the number of ml of blood or plasma which are completely cleared of urea by the kidney per minute. That is called urea clearance. This plasma, it is not completely cleared of urea. Only 10% of this urea is removed by the kidney. Or this plasma is not completely cleared of urea, only 10% of urea is removed. That is 750 ml of plasma pass through the kidney per minute and only 10% of the urea is removed. 750 ml of plasma pass through the kidney per minute and only 10% is removed. This is equivalent to completely clearing of 75 ml of plasma per minute. Here it is, maximum clearance is there. Maximum clearance. Let's see maximum clearance. Maximum clearance or CM. If the urine volume exceeds 2 ml per minute, if the urine volume exceeds 2 ml per minute, rate of urea elimination is at a maximum. Rate of urea elimination is at maximum. And this is proportional to the concentration of urea in the blood. And is proportional to concentration of urea in blood. So if the urine volume exceeds 2 ml per minute, the rate of urea elimination is at a maximum and it is directly proportional to the concentration of urea in blood. So if blood urea remains unchanged, urea is excreted at the same rate whether the urinary output is 4 ml or 8 ml per minute. If the urea remains unchanged, urea is excreted at the same rate whether the urinary output is 4 ml or 8 ml per minute. So volume of blood cleared of urea per minute can be calculated from the formula. Volume of blood cleared of urea per minute can be calculated by the formula U into V by B. U into V by B, where U is concentration of urea in urine. Concentration of urea in urine. That is in mg per 100 ml. That is U. Then V is volume of urine in ml per minute. Volume of urine in ml per minute. Then B is concentration of urea in blood. Concentration of urea in blood, that is in mg per 100 ml. Mg per 100 ml. So volume of blood cleared of urea per minute can be calculated from the formula U into V by B. U is concentration of urea in urine. V is volume of urine in ml per minute. Then B is concentration of urea in blood. So by substituting average values, the number of ml of blood cleared of urea per minute equals 1000 into 2.1 divided by 28. That is equal to 75. It means that the amount of urea excreted in urine in 1 minute is equal to the amount found in 75 ml of blood. This means that the amount of urea excreted in urine in 1 minute, it is equal to the amount found in 75 ml blood. So the clearance which occurs when the urinary volume exceeds 2 ml per minute, this is termed as maximum urea clearance, and the average normal value is about 75 ml. Maximum clearance is about 75 ml. That is maximum clearance. Next one is standard clearance. Next one is standard clearance. Standard clearance. Here, when the urinary volume is less than 2 ml per minute, the rate of urea elimination is reduced. When the urinary volume is less than 2 ml per minute, rate of urea elimination is reduced because relatively more urea is reabsorbed in the tubules. More urea is reabsorbed in the tubules and it is proportional to the square root of the urinary volume. It is proportional to square root of urinary volume. So such clearance is known as this standard clearance. So standard clearance is equal to U into root V by B. Here the average value is about 54 ml. So standard clearance means when the urinary volume is less than 2 ml per minute, the rate of urea elimination is reduced because relatively more urea is reabsorbed in the tubules and it is proportional to square root of the urinary volume. This is known as standard clearance and it is represented as CS is equal to U into root V by B, and the average value of this standard clearance is 54 ml. So coming to the procedure of the test, the test should be performed between breakfast and lunch because the excretion is more uniform during this time. The patient is given a light breakfast, that is 2 to 3 glasses of water and a light breakfast. 2 to 3 glasses of water and a light breakfast. That time the bladder is emptied and that urine is discarded. So first urine is discarded and the exact time of urination is noted. Then 1 hour later, urine and blood are collected. So 1 hour later, both urine sample and blood sample are collected. Then a second specimen of urine is collected at the end of another hour. At the end of another hour, second specimen of urine is collected. Then the volume of each specimen of urine is measured. Volume of each specimen of urine is measured and the concentration of urea in the blood and in urine is determined. The volume of each specimen of urine is measured and the concentration of urea in blood and urine is determined. The average value of the 2 specimens of urine is used for assessing the quantity and urea content of urine. The average value of the 2 specimens of urine, these are used for assessing the quantity and urea content of urine. So coming to the interpretation of the test, urea clearance of 70% or more. 70% or more means the kidneys are excreting satisfactorily. Then between 40 to 70%. That means mild impairment is there. When between 20 to 40% means moderate impairment. Then below 20% means severe impairment of renal function. That is the interpretation of the test. In acute renal failure, the urea clearance or the maximum clearance and the standard clearance, both are lower. In acute renal failure, this maximum clearance and this standard clearance both are lowered, then increases again with the clinical improvement. Then in the case of chronic nephritis, the urea clearance falls and reaches a value half of the normal. That is about urea clearance test. Then next test based on the glomerular filtration is endogenous creatinine clearance test. Endogenous creatinine clearance test. Creatinine clearance test. So at normal levels of creatinine, this creatinine is filtered at the glomeruli. Normal level of creatinine, this creatinine is filtered at the glomeruli, but it is not secreted or reabsorbed by the tubules. It is not secreted or reabsorbed by the tubules. So its clearance gives glomerular filtration rate. So at normal levels of creatinine, this is filtered at the glomeruli, but it is not secreted or reabsorbed by the tubules. So its clearance gives GFR, that is glomerular filtration rate. So this is a convenient method for the estimation of this glomerular filtration rate because it is not a normal metabolite in the body. This creatinine is not a normal metabolite in the body. Then it does not require the intravenous administration of test material. And the elimination of creatinine, that is, and the estimation of creatinine, that is simple. That is creatinine clearance test. Then here measurement of 24-hour excretion, 24-hour excretion of endogenous creatinine is used. In the procedure, 24-hour excretion of endogenous creatinine is used in creatinine clearance test. This longer collection period minimizes the timing error. Here 24-hour excretion of endogenous creatinine. Coming to the procedure of the test, 24-hour urine specimen is collected and its total volume is measured. Then blood sample is also collected for serum creatinine determination. Then we will estimate the serum and urinary creatinine concentration. Both urine and serum creatinine are estimated. So clearance is equal to, that is CR, it is equal to U into V by P. U into V by P. U means urine creatinine. Urine creatinine in mg per dl. In mg per dl. Then V is volume of urine in ml per minute. Volume of urine in ml per minute. Then P means serum creatinine. Serum creatinine in mg per dl. Then normal values for creatinine clearance varies from 95 to 105 ml per minute. This is the normal values for creatinine clearance. That is about creatinine clearance test. Next one is inulin clearance test. Inulin clearance. This inulin is a homopolysaccharide. It is a homopolysaccharide and it is a polymer of fructose. It is a homopolysaccharide and it is a polymer of fructose. It is an ideal substance of this clearance because it is not metabolized in the body. It is not metabolized in the body. Then following IV administration, it is excreted entirely through glomerular filtration. It is not metabolized in the body. Following IV administration, it is excreted entirely through the glomerular filtration and it is not excreted or reabsorbed by the renal tubule. So it is an ideal substance for the clearance. So the number of ml of plasma which is cleared of inulin in 1 minute is equivalent to the volume of glomerular filtrate formed in 1 minute. Number of ml of plasma which is cleared of inulin in 1 minute is equivalent to the volume of glomerular filtrate formed in 1 minute. Then coming to the procedure of the test, here the test is performed in the morning. A light breakfast is given to the patient. Then after half an hour, 10 gram of inulin, 10 gram inulin dissolved in 100 ml of saline. In 100 ml saline, 10 gram inulin dissolved in 100 ml saline at body temperature is injected IV at a rate of 10 ml per minute. 10 ml per minute. So after half an hour, 10 gram of this inulin dissolved in 100 ml of saline at body temperature is injected IV at a rate of 10 ml per minute. Then 1 hour after the injection, the bladder is emptied and this urine is discarded. First urine is discarded. Then we will note the time. Then after 1 and 2 hours, again collecting the urine. Then volume of urine is measured and it is analyzed for inulin content. So after 1 and 2 hours, this collecting urine, and then volume of urine is measured and analyzed for this inulin content. At the midpoint of each collection of urine, 30 and 90 minutes after the initial emptying of the bladder, then 10 to 15 ml blood is withdrawn. 10 to 15 ml blood is withdrawn, then plasma separated and analyzed for inulin concentration. At the midpoint of each collection of urine, 30 and 90 minutes after the initial emptying of the bladder, 10 to 15 ml blood is withdrawn, plasma separated and analyzed for inulin concentration. Coming to calculation, inulin clearance CIN is equal to U into V by P. U into V by P. Here U is milligram of inulin per 100 ml of urine. Milligram of inulin per 100 ml of urine. V means ml of urine per minute. P is milligram of inulin per dl of plasma. Milligram of inulin per dl of plasma. Average value is about, this is the average of 2 samples. Then this average clearance is about 125 ml per minute. 125 ml. That is the inulin clearance in adult. Range is about 100 to 150 ml. Here it is 125 ml. Range is about 100 to 150 ml. That is inulin clearance test. Next one is Chromium EDTA clearance test. This is a simplified single injection method for the determination of Chromium-51 EDTA clearance. This is a simplified single injection method. This is for the routine assessment of this glomerular filtration rate in adults as well as in children, because it is particularly convenient in children because it is not easy to collect 24 hours urine in children. So it is particularly convenient in children. So it is used for children younger than 1 year old. So this is about the test based on glomerular filtration in renal function test. This is today's topic. Thank you for watching.